Jesuit Refugee Services and Lawyers for Human Rights say they're concerned that various healthcare facilities in Gauteng are discriminating against marginalised groups. The organisations are working and advocating for the rights of refugees, asylum seekers, migrants, undocumented persons and persons affected by statelessness. They also allege that some facilities in Gauteng are deliberately withholding proof of birth certificates. For more on this, we're now joined by Advocacy Coordinator at Jesuit Refugee Services, Abigail Dawson. A very good evening to you and thank you so much for speaking to us, Abigail.
Good evening and thanks for having me and the organisations represented on the show.
So let's just first start in brief, the full content of your complaints. If you can just give us the salient points and then we'll talk about the action you've taken thereafter.
Sure, it's a twofold problem. So the first is that we've had a number of parents who consulted with us, raising that they've been charged fees for maternal and reproductive health services, which, as I'm sure many of us know, is a constitutional right to have access to health, as well as in our National Healthcare Act providing free healthcare services for pregnant and lactating women. And the second concern that's coming out of this is that health facilities are withholding proof of birth documents from parents who cannot settle these. And a proof of birth document is a central document to registering a child's birth. So not registering a child's birth has compounding impacts. Essentially, this child is not recognized by the state, and it puts them at considerable risk of exploitation and exclusion from services including healthcare, education, and social protection. Allege, in some of its work on statelessness, has had this issue occur for older children when they need to register for an ID and don't have access to a proof of birth.
Okay.
So
can I just jump in there and ask this question? You've obviously communicated with the Department of Health. Is this first of all policy, or what is the explanation given to those, for instance, whose birth certificates are withheld because they won't pay for free services such as reproductive health care services?
So to our knowledge, parents have not been given any formal communication. They've just been denied this access to documentation and been sent an invoice. We have thankfully had a response and a speedy response from the Department of Health in this regard, and we'd like to extend our thanks for that. But we are concerned that this is a systemic issue rather than an issue concerning the number of parents we've written about. And we've requested that the department address this at a systemic level because we've noted it across a number of facilities in Gauteng. And this is obviously only cases that we've had come to our offices, and we're unsure of how widespread this issue is. And it is something that is preventable. So it goes against, well, national legislation, but as well as a circular within the department, which provides direction that health facilities should provide this completed form for every child before they leave the health facility.
I suppose also for the benefit of our viewers who may not be aware, obviously it does go against our own constitution, but there are also several international instruments that it goes against. So just lay this out for us.
Yeah, so, it's important, one, locally that we know it goes against that, but, for our international representation, we are bound to various human rights instruments, and this includes the Conventions of the Rights of the Child and the African Charter on the Rights and Welfare of the Child, which South Africa is signatory to. So in ensuring birth registration, which every child has a constitutional right to a name and nationality, and international human rights has the right to birth registration, it's really in the best interest of the state to ensure that every child is registered.
Just how much is it exacerbating the state of, or the risk of becoming stateless, this refusal to give parents birth registrations for children?
I mean, it really increases the risk of a child becoming stateless. And, being stateless means you're not recognized by any country, which means you don't have the protection of that country. And for us as organizations, we really see this as a lost opportunity. These become young, ambitious people who then are not registered in the country and really struggle to access services, including banking services, driving licenses, and the ability to find stable employment or enroll in tertiary education. So it becomes a compounding issue for various other departments, including the Department of Education and having to register children for school. And even if we look at the issue in terms of public health, we know that maternal and early childhood health is, critical to the health of a nation, and preventing children from being able to access this easily is detrimental to everyone.
Are you yourselves looking at taking legal action, even if the departments do issue our communiques speaking about how unlawful this is, but how will you go about ensuring that the obligations of the state towards these migrants are upheld?
So, our first attempt is to really work collaboratively with the state. We are wanting to work in partnership and to make these systems work better. So that's our first option and why we've sent this letter, in the hope that these issues can be resolved. Jesuit Refugee Services does not provide, we don't do litigation so the other organizations, Section 27 and DoH Human Rights, would need to speak to this. Obviously, we will be monitoring the situation on the ground, but for us, this is a first step in alerting the state to this practice. We did get a response from the Department of Health, and we will be meeting with them further in the hope that this can be resolved outside of the courts.
Thank you so much for taking the time to speak to us. Advocacy Coordinator at Jesuit Refugee Services, Abigail Dawson. As I mentioned, her organization working with other organizations in a bid to protect the rights of migrants to receive free public services which are due to them.